Hi, my name is Karen Murchison. I'm applying for the Community Service Director at Lubbock Children's Hospital in Memphis, Tennessee.
Hello, Ms. Murchison. Thank you for coming today. In your opinion, what qualifies you for the position to be our Director of Community Service here at Lubbock?
I have 20 years of nursing experience, 1 year in the adult setting and 19 years at Lubbock. I started out in the special care unit, which is the infant critical care step down, servicing children 0 to 1 year of age. I then moved to the ER. I served as a staff nurse for 5 years. In that time, I was a preceptor, which oriented new nurses as well as seasoned nurses to the emergency department. I then moved into the charge nurse position and was charge nurse for 7 years. This included overseeing the flow of the ED patient flow, as well as supervising nurses, EDTs, and even housekeeping. After that, I moved to the patient care coordinator position, which was middle management, liaison for the staff to upper management. I was responsible for supervising the floor during my shift, which was actually at night, for patient flow and the nurses, and oversaw the charge position. I was in charge of 15 nurses myself and did their yearly evaluations. I did this position for a year, and then I moved to the PD flight transport RN. I've been in that position for 3 years. It includes a team leader, which is me, which is the nurse, and then a respiratory therapist and a paramedic. We do critical care, neonatal, as well as pediatric transports from outlying facilities to Lubbock Children's Hospital, the NICU, inpatient, or to the ER for evaluation.
Okay. What kind of certifications do you hold currently?
I currently hold basic life support, pediatric advanced life support, advanced cardiac life support, neonatal resuscitation protocol, trauma nurse core curriculum, and advanced certification of certified pediatric emergency nurse, as well as stable, which is recognizing infants with cardiac problems, full-term infants, cardiac problems, and other things that can affect them.
Excellent. My next question to ask you would be, what would be your vision and your mission as Director of Community Services at this facility if you were to be hired?
My mission would be to provide basic health care services to the community who otherwise wouldn't have access to it. My vision would be to provide a mobile health care unit that could go into the community staffed with nurses, paramedics, EMTs, that could provide basic health screening assessments and refer them to Lubbock if need be for more serious medical care. Also to go to churches to provide education as far as car seat safety, basic child safety, and basic CPR classes for those that wanted it. Also to go to schools to do health assessments, health screenings if needed, education to teachers and school nurses for dealing with chronically ill children that receive medical care on a daily basis that are enrolled in school, as well as recognizing problems with an acutely ill child and when to call for help and when they need to be transferred to another facility.
Excellent. My last question is more of a leadership question. What makes you, in your opinion, the best leader for this position?
Well, I do have experience, as I stated before, as a leader. As charge nurse, I was overseeing one of the busiest ERs in the country. We had 60 beds, which turned over very quickly, seeing sometimes over 400 patients in a 24-hour period. I was also patient care coordinator, which was also a leader over the charge nurses, but under the director, which oversaw the charge position as well as nursing flow and communicating from the staff to upper management with concerns, problems, and new procedures and policies. I also have a democratic style. I believe in autonomy. I believe that people do better honing their skills when they are left to do them without somebody micromanaging everything they do. I believe as a community service that as a director I would need to let them do that so they could do the best they could for the patient, providing that care. As far as public relations go, I do have experience with that with PD Flight. We do go to rural areas. We do education as far as CPR classes. We give education to staff in rural hospitals for NRP, PALS, anything dealing with pediatrics, which a lot of adult facilities are not equipped or educated to care for properly. We did put a PD Flight base in Jonesboro, Arkansas a year ago. We were expected to do 300 transports in that year in an area which didn't really know who LeBonner was or anything about PD Flight. In that time, due to our public relations and education and outreach services to the community, as well as the staff of the hospitals, we increased that number from 300 expected to 600 actual transports for eastern Arkansas and southeast Missouri.
Thank you.